for joining us today for our webinar on Goshen Health Goes Electronic with RapidFiler. From conversations with your peers, it's clear that MEDITECH customers want an easier way to get documentation into a patient's eChart. RapidFiler helps MEDITECH hospitals do exactly that. It has been shown to greatly improve the accuracy of patient charting while saving paper and manual time. If you've heard of RapidFiler before, we have expanded functionality to help automate the process and format of 835 and 837 documents, as well as XML and text. My name is Brittany White, and I'm a part of the product marketing team here at Forward Advantage. I will be the moderator of today's webinar. Our speakers today are Kevin Frazier, Manager of Client Services here at Forward Advantage, as well as Sue Plank, TUL Coach Coordinator at Goshen Hospital. We'd like to thank both Kevin and Sue for joining us today and sharing in their expertise of RapidFiler. There are a lot of people on the line, so your phones are muted. If you have a question, please enter it into the question panel, and we will do our best to get to your questions at the end of the webinar. We are recording this webinar, and we'll send out an email with a link to the recording following. Thank you again for your time. And with that, I'm going to pass it over to Kevin.
Thank you, Brittany, and thanks to everybody for joining the webinar today, spending a little bit of your day with us. I'm just going to give a brief overview of RapidFiler, and then we'll get to the meat of the presentation with Sue. RapidFiler was basically built to fill a need for customers who were having trouble getting external documents into the MEDITECH chart, like Brittany was describing. The manual print and scan process was getting time-consuming and wasting paper. So we worked with customers to come up with a more efficient and effective way of putting those documents into MEDITECH. What we built was a really straightforward interface, a client-based interface that users can manipulate incoming PDFs. They can split documents, so if you have large batches of documents that may reference multiple patients, you can split those documents up and put them back together so that you have a package of pages for each specific patient. You also have the ability to pull cover pages off or support for those pages that you don't need. And then you also have an optional lookup into the MEDITECH DR that helps match a patient to the documents more accurately. And as Brittany mentioned, we also have other formats that we support, not just PDFs, but 835 and 837 claim documents, as well as other text formats as well. You'll see over here in this document, or in this diagram, PDF is listed as a format, but the other formats are there as well. When you purchase RapidFiler, it comes included with PDF processing. And the destination options, we're going to be talking about putting documents into the chart through the MEDITECH Enterprise Content Manager today, but there are other ways to process those documents as well. So again, as I said, we're going to be focusing specifically on the patient chart in MEDITECH today, and that is going to be a bulk of what Sue Plank is going to be talking about in our integration with Goshen Health. Goshen has been a customer of Forward Advantage for 15 years, started out with Communication Director for report distribution. And throughout our relationship, they've developed a deeper relationship with us with single sign-on and now the new RapidFiler product. So I'm going to go ahead and I'm going to switch over to Sue for the rest of the presentation and let her walk you through their workflow at Goshen Health.
Right. Thank you, Kevin. And I am happy to join you today and tell you a little bit about our story as we selected and implemented RapidFiler as a solution to our electronic documentation. So just to start off with a little bit about Goshen Health, we are located in northern Indiana. We are a health system with about 122 beds in the hospital, but we also have about 27 physician office or clinic locations located in 4 counties in northern Indiana. Of course, with those multiple locations, we also have 3 different electronic medical records. And so that creates a challenge in terms of being able to communicate orders, requisitions, authorizations, those kinds of things from the clinics back to the hospital. So as you can imagine, having 3 EMRs, it does create a challenge. So our project focus as we worked through this was on how the hospital can improve their process of receiving requisitions and authorizations from those outpatient locations. Because, as you can imagine, it was really a long-standing frustration with the stakeholders. So there was frustration between physician offices and the hospital, often because the fax system seemed unreliable. Physicians' offices would report, "I've sent the fax," and yet the hospital side did not receive it in their fax queue. The hospital system was structured on kind of a dashboard of incoming faxes, which required intervention from the patient access colleagues to actually take those PDFs, index them so that it made them searchable. We had, our process was to have the entire department be responsible, and therefore when all are responsible, often no one really felt ownership in that. And so we often saw large volumes of faxes unfiled and in the queue, making them very difficult to locate for a particular patient. The indexing itself was very manual. They were text fields, and so it left room for a lot of filing errors. There were no field controls on them. So we might have a date of birth entry in a physician field or physicians' names that were entered in different ways. Last name only, first name with an initial, first initial with a last name, a phonetic spelling. So you can imagine the challenges of searching in that environment. Our current system also had no tools for understanding or managing the volumes in our system, and there was not a particular person that was noted as responsible for the performance of the system. So what happened often then is that we would learn that there was a problem because an external customer would let us know that they had a hard time faxing something to us. So our response was generally reactionary as opposed to proactive. So our aim in our project was to find a system or create a system that would be reliable, that had tools for managing the system, including performance, understanding volumes, errors, those kinds of things. It had to be easy to use for all of our users, both the folks who were working with it in patient access, as well as those others in the system who needed to see those requisitions and authorizations. We wanted them to be able to find it on the first try. And we wanted consistency. We wanted controls in the system that removed the variability in filing so that the user would have a consistent way to find the requisition every time. Our initial state was an 8-step process. The requisitions or auths would be faxed to a line at the hospital. Those calls would roll over to one of 4 external 800 lines. Of course, we wanted to reduce the risk of customers getting a busy signal. And then those fax calls were received by a third-party fax management vendor who converted the fax images to PDF and placed them in a Goshen Health specific folder. Then we hired a second third-party vendor who designed a custom online fax system to comb that first folder for the compiled faxes and then move them to our server and in the process create a thumbnail image to be displayed on the user interface dashboard. And then they helped us also design that dashboard. The documents were then indexed by our patient access colleagues from the dashboard and saved. And then those saved documents were then searched for and opened by folks like schedulers or other end users in our health system who were working with those requisitions and orders from our outpatient clinics. The document was then printed at the point of pre-registration and then scanned into the MEDITECH account at that point. So if we take a closer look at that first part of the process to understand the opportunities we had, I'm sure you can think of many, even in that short description of our process. Because we were working with different electronic EMRs with our own physician clinics, and we're also working with many physicians that are outside of our own health system, we needed a system at the hospital that would allow us to work with many different requisition formats. However, we also realized that the largest volume was with our own physician clinics. So if we could figure out a way to streamline those requisitions and authorizations, it would take care of more than 50% of our fax volume. The fax transmission technology also doesn't always present the best resolution. So sometimes our faxes were illegible, and that was a problem for us too, requiring things to be resent. Like I said earlier, we had 2 unrelated third-party vendors. So those electronic handoffs resulted in an increase in the number of bad or corrupted faxes in our system because they were unrelated. One vendor's workflow did not necessarily tie in with the other. And we began to realize that as we saw the inconsistency in the transmission, it was actually becoming a larger issue than we had originally realized, and suspected that to be the cause of some of our mysteriously missing faxes. So another ongoing challenge for us has been how to manage standing orders. While this was initially not part of our scope in the project, we have known that we wanted to look for something that might actually also help us manage these orders. Standing orders are also requisitions, but they're good for multiple visits. So we needed a way to store these in a way that they were easily accessible for future patient visits. Our initial state for this was purely paper and manual. I mean, literally. The fax image was printed, placed in a manila file folder by patient name. We would write the date the patient visited on the requisition, and then file it back in that manila folder. We would then we'd make a copy of it and scan it into the account for that visit in MEDITECH for that time. So it was difficult to effectively manage these orders, particularly being proactive about expiring, plus just the motion waste of having it be in a location where registrars who are actually working with patients right then would actually need to leave their desk and go to the file and retrieve that paper requisition. So if we think about our current state attributes, we had a lag time in indexing, making it difficult to find requisitions and authorizations when they were needed. Physicians' offices were asked to resend documents, as I had described earlier, and the document database had also a slow response time. So navigating those search options was often frustrating. Splitting and merging multi-page faxes was cumbersome, and the management of the requisitions and authorizations happened as patients walked in or 2 days prior to the scheduled appointment. That included incomplete orders. So that created a bit of a scramble often at the last minute when we realized the order that we did have was incomplete and we needed to get that resolved quickly. The other piece that happened in our initial state system was that the consumed requisitions and authorizations remained in the database, which increased our risk of accidentally using them for future visits. So as this project team worked together using A3 thinking, we reviewed our current state, tried to understand more clearly the waste and the opportunities for improvement, and created a future state that became our roadmap for improvement. It became pretty clear in this process that we needed a new software solution for the mechanics of managing our requisitions and authorizations that might reduce the number of vendor handoffs and give us some tools to better manage this process electronically. So the project team created a list of key selection criteria and some Some critical things out of that were having one person at a time being able to work on a PDF. We had a system currently that allowed multiple people to index, but only one would save, so it was kind of over-processing for us. An easier way to split and merge pages, and clearly, ultimately, we wanted to reduce the number of touches required for end users to search for orders. So with this list of search criteria, we looked at several solutions, and ultimately RapidFiler was our product of choice. So after that project team made that selection and it was approved, we put a team of individuals together to implement our project plan. Our implementation team consisted of an implementation lead, which was the role that I served. We also included on that implementation team a team member from information services. They were critical in helping us with server administration tasks and network administration. We included the manager of patient access, who is responsible now for the workflows related to our electronic documentation management for requisitions and authorizations. We also included not just the manager, but a patient access colleague who would actually be doing the workflows. We included our quality trainer, who's responsible for training the colleagues in that area, and we also included the HIM director to ensure that our implementation would meet all of our medical record requirements. So with that team in place, we put a 3-phase project plan together. And in our first phase, we worked at setting up our file server, mapping to MEDITECH using the form ID and the application ID so that our documents knew where to go in the Echart and also in the EMR. We set up our file structure in Windows, and we did a lot of testing. We tested our mapping to MEDITECH. We tested patient entry to understand and establish the workflows that we would need. We tested to understand our cycle time so that we knew how long this process took, so that we could identify the staffing changes and reflect on that testing in terms of what we might need in terms of staffing. We trained 17 colleagues in the 3 days prior to the go live using our standard work documents. And we did that training by doing one-on-one training with the trainees at their computer so that they would have the ability to play and test before going live. And we did a communication plan, which included some face-to-face interaction with the key stakeholders at point of service. And it also included new workflows for our Goshen physician offices, our outpatient offices, with the standard work that they would need to now export their documents. In phase 2, we did a soft rollout to the early adopters. We chose just a few offices and had them test it with live requisitions. And as we continued to feel good about that process, we moved it then to all of the offices in the second phase. And our last phase was focused on what do we do with the remaining fax volumes that are outside of our own physician clinics. And what was included in that phase was understanding what those volumes were that were remaining, making sure that we stopped any false demand, and that we could really truly determine the values that needed to be moved through the fax appliance and ultimately into RapidFiler. So the workflows that we identified that we needed to make this process successful were workflows related to how to file into MEDITECH from RapidFiler, naming the files, splitting and merging them, and also workflows related to how do you manage these requisitions and authorizations, making sure that we aren't waiting until the last minute to give feedback on whether or not the authorizations and requisitions are complete. And so the ability to view them quickly as they come in made that process much easier. We also created, like I said, standard work for our NextGen users because they actually use the export function on NextGen rather than faxing. So it allowed them to export directly into our file server, and that way we can see it using the RapidFiler folders. So with that redesign, we took an 8-step process and ultimately moved it down to a 4 and sometimes a 6-step process. So now all requisitions are still sent to a fax line, if you will, or they are exported. They are, for those that are sent to a fax line, they are converted to PDF via fax appliance, all done in-house now. And the documents are processed by our patient access classifiers. If the person who's classifying, this is our new term for indexing, if the patient already is scheduled for an appointment, that person can quickly see that, and the document is no longer printed and scanned. It is simply found using the data repository and accepted directly into MEDITECH. So another benefit of this process is that when a file is accepted into MEDITECH, it no longer resides in RapidFiler and cannot be inadvertently pulled for a future patient visit in error. The real bonus for us was the standing order workflow. RapidFiler gave us a way to manage our standing order file, and I'm happy to say that is now managed electronically. The paper files are no longer used. In the same way, they are PDFs and they are now in a folder. We can access them. RapidFiler gave us a way to annotate on those so we can still retain them for future use. And it just eliminates walking to the front check-in desk, and it makes it centrally available to everyone who needs access to those standing orders. In addition, because of the way we chose to name those files, we have the ability to use the search tools in File Explorer to search and anticipate expiration dates and manage that process so much better, so that it no longer runs the risk of delaying patient care. Our implementation time frame I shared on this screen. We started working on this project last July, and while it seems like this is a long time frame, I just want to point out that the time from our kickoff call with RapidFiler to the point that we were ready to bring on early adopters was a little more than 2 months. And then shortly after those early adopters, we were able to go live with the rest of the physicians. So the rest of this project is really our timeline, which is kind of outside of RapidFiler, where we wanted to learn more about our practices and what was going on with how we were receiving documents so that we could right-size our appliance purchase. So it does, I mean, for us, this was the more complete project. RapidFiler was a portion of that solution. So the benefits of the RapidFiler solution for us, there has been a cost savings, and that cost savings is related to bringing the phone lines in-house, and also the cost of processing those faxes with the third-party vendors. So our cost savings is about $10,000 annually. But we've seen many other benefits. We've also benefited from having access to software support. While the interface is extremely simple, we have had opportunities to make suggestions for improvement or have had several occasions where we've had additional questions. And I will say the response time from Forward Advantage has been timely and attentive. The system is reliable, which has a twofold benefit. The physician offices are amazed how quickly the documents are showing up in patient access. It does not have the lag time we had before with the fax methodology. And we are still working on decreasing duplicate demand, but it's definitely getting better. Part of that duplicate demand comes from not trusting, and so you fax it everywhere or send it everywhere. So we continue to work at that, but clearly because of the trust that people are building in this system, it is definitely getting better. The tools that are available allow us to create workflows to manage the files upon receipt. So incomplete and invalid orders are tended to immediately, and not waiting until right before the scheduled procedure. The process improvements have allowed us to streamline the document management process. We now have less colleagues indexing the incoming faxes, and we've streamlined where colleagues look for requisitions. Ultimately, they look in one place, which is in MEDITECH. And the end users are in MEDITECH already, so that makes it very easy for them. So if I reflect the insights that we've had, what helped us, just to highlight a few, getting colleagues trained quickly just before the go live and being methodical about that was very helpful. And I'll also say the audit log that's part of RapidFiler allows us to see where the MEDITECH accounts, what a MEDITECH accounts the documents went to. So it allows us to see training opportunities as well as to be able to see any accounts that might have been affected by errors. We found that very helpful. What's hindered mainly for us was having 3 electronic medical records, and it didn't go, that part did not go as smoothly as we initially thought it might. However, working with the application specialist still made it something that was possible for us to do. What could be improved? Of course, that export function from the other EMRs, love to see an improvement there, but that's not part of the RapidFiler function. But for our project, that could have gone better. The struggle getting annotation in the right spot. It's better, but it is not perfect, and so sometimes orders have very small type, and so that is still really a challenge. Things that went very well, clearly reducing paperwork. That is something we have been able to do. We are delighted that we no longer are printing and scanning. Reducing the rework and the duplicate work. We like the feature that RapidFiler has of only allowing one user in the PDF. Reducing the searching for the end user, just being able to look in MEDITECH and finding it there. So having workflows that support that and placing it there much sooner has been a real plus for us. And finally, I would say the other thing that went well is the simplicity of the dashboard in RapidFiler allowed the training to go quickly, and as we continue to have new users, it allows that training to go well as well.
Well, thank you, Sue. That was great. I want to thank Kevin as well. We are a little short on time. We do have a couple questions. I'm going to try to get through just a couple, and then we'll close. The first question that I see here is the MEDITECH DR mandatory for if we wanted to purchase RapidFiler? And I'll go ahead and give that to Kevin.
That's a good question. The DR lookup is optional in RapidFiler. Obviously, it helps make the association with the patient more accurate, but RapidFiler does work without the DR lookup, so you do not need to purchase the DR.
Thank you. And another quick question that I see is it possible to do more than annotation on one single page?
Yes, within RapidFiler, you can do multiple annotations on a single page or on multiple pages as well.
Great, thank you. And I think this question is for Sue. What would you say the biggest benefit is for Goshen Hospital?
Well, I think we have found the efficiency that RapidFiler provides us in terms of no printing and scanning, and also making some of our very manual processes electronic has probably been our biggest takeaway for RapidFiler.
Great, thank you. We're going to do just one more question, and that is, does this integrate with MEDITECH Magic 5.67?
Yes, it does. RapidFiler has the ability to work with different flavors of MEDITECH. We just need to make sure that we have the right interface for the cold feed, and we're good to go.
Thank you, Kevin. Okay, unfortunately, that's all we have time for. We do want to respect your time today. So for those of you who didn't get your questions answered, we'll follow up with a response in the next day or so. And as I mentioned before, this is recorded, so we'll send it out in an email with a link. Thank you again for attending, and please follow up with our client services or dedicated sales team with any additional questions. This concludes the webinar.